you're over 60, there are 10 changes happening to your skin that you need to know about, and a few of them can look completely harmless. That rough patch that feels like sandpaper, it could be more important than you think. Those purple bruises that seem to appear overnight, there's a reason they become so common after 60. And that tiny spot that keep crusting over and coming back, that's one you definitely don't want to ignore. Hi, my name is Dr. Morgana Colombo. I'm a board-certified dermatologist practicing in Northern Virginia and founder of Vida Derma, a science-backed skincare line for aging skin. So most changes in aging skin are usually normal, but there are some skin changes that can be early warning signs of cancer or even health problems elsewhere in your body. Today, I'm going through 10 things you need to know about your skin, especially if you're over 60 years old. And most importantly, I am going to explain how to tell what's probably normal from something that deserves a trip to your doctor. Pay close attention to numbers 4, 5, and 10, because those are skin changes people often miss. Number 1, dry skin is extremely common, but it's not always just a nuisance. If your arms and legs seem much drier than they did 20 years ago, there's a reason. As we age, our skin produces fewer natural oils. The outer layer also becomes thinner and has a harder time holding on to moisture. Dermatologists call severe dry skin xerosis, and it's extremely common in older adults. We see it like all the time, but here is what matters. Dry skin isn't only about appearance. When your skin becomes extremely dry, it can itch, crack, and sometimes even bleed. Those tiny cracks can also create openings where bacteria can enter, potentially increasing your risk of infection. So fortunately, some simple changes can help. Use a gentle, fragrance-free cleanser instead of harsh soap. Avoid extremely hot showers, which can strip away even more natural oils. And here's an easy trick, guys. Moisturize immediately after your shower or bath while your skin is still slightly damp. Look for thicker moisturizers containing ingredients like ceramides or petrolatum rather than thin, heavily fragranced lotions. Number 2, your skin is going to bruise and tear much more easily. Have you ever looked down at your arm and thought, where did that bruise come from? This becomes incredibly common as we get older. Your skin gets thinner, you lose some of the protective tissue underneath it, and the small blood vessels become easier to damage. That's why something as simple as bumping into a table can leave a surprisingly large purple mark. You may notice these bruises especially on the backs of the hands, forearms, legs. Doctors sometimes call this senile purpura, although you may also hear the term actinic purpura. And despite how noticeable and alarming these bruises can look, they are totally harmless. But there is an important exception. If you're suddenly bruising much more than usual, developing very large unexplained bruises all over, or noticing other unusual bleeding, don't automatically assume it's aging. Certain medications and medical conditions can make you bruise more easily. And remember that aging skin can actually tear from relatively minor injuries. Moisturizing regularly, protecting your arms and legs, and being careful around sharp furniture and other objects can help. I love this over-the-counter lotion called Derm to cosmetically help a little bit. Number 3, constant itching can sometimes tell you something about the rest of your body. This one surprises people. You can have intense itching even when there's almost nothing visible in your skin. Doctors call itching pruritus, and very often the explanation is simply dry skin, but not always. If you're experiencing persistent or severe itching, especially without an obvious rash, don't automatically assume it's just your skin getting older. In some cases, persistent itching can be associated with medication side effects or underlying medical problems, such as like kidney problems, liver, thyroid. and other parts of the body. That doesn't mean you should worry every time your arm itches. But if the itching is persistent, widespread, wakes you up at night, or doesn't improve with good skincare, it's worth discussing with your doctor. Now, number 4 is one I really want you to remember, guys, because people can mistake this for ordinary dry skin for months or even years. So that rough patch of skin that you think is just dry skin might be precancerous. Run your fingers across your forehead, scalp, ears, face, or the back of your hands. Do you feel a small rough patch? Maybe it feels like dry or almost like a tiny little piece of sandpaper. It could be an actinic keratosis. These spots develop after years of accumulated UV exposure from the sun, and they become increasingly common as we get older. Here's why I don't want you to ignore them. Actinic keratosis, or AKs, are considered precancerous because some can eventually develop into a type of skin cancer called squamous cell carcinoma. Fortunately, they're often very treatable. A dermatologist may freeze them, prescribe a topical medication, or recommend another treatment depending on how many you have or where they're located. And even laser can work. So if you've had a rough or scaly patch on a sun-exposed area that simply won't disappear, don't just keep scratching it or covering it with a moisturizer. Have someone take a look at it. Number 5, your risk of skin cancer increases significantly as you get older. Skin cancer is the most commonly diagnosed cancer in the United States, and decades of accumulated sun exposure matter. The 3 major types you should know about are basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is extremely common and often grows like really slowly. Squamous cell carcinoma can sometimes behave more aggressively, and melanoma is the least common of the 3, but can become much more dangerous if it spreads. But here's a mistake I don't want you to make. Don't assume skin cancer has to look like a scary black mole. Sometimes skin cancer looks like a small pink or shiny bump. Sometimes it looks like a scaly patch. Sometimes it's a tiny sore that heals, bleeds, crosses over, and then seems to come right back. So pay attention to a new growth, a sore that won't heal, a spot that repeatedly bleeds or crusts, or a mole that's changing in size, shape, or color. If something on your skin isn't healing or keeps changing, don't spend 6 months wondering what it is. Get it evaluated by a dermatologist. Number 6, you need to know what your own skin normally looks like. Your dermatologist may see your skin once a year. You see it every single day. That gives you an advantage. Every so often, look over your body and pay attention to your normal spots, freckles, and moles. And don't just check your face. Look at your arms, legs, chest, abdomen, and the tops of your feet. Use a mirror or ask someone to check difficult areas like your back, scalp, behind your ears. You're not trying to diagnose skin cancer yourself. You're looking for one very important thing, guys. Change. Is something new? Is something growing? Has a mole changed color? Is one spot bleeding while everything else looks normal? When you know what's normally there, unusual changes become much easier to notice. Number 7, sunscreen still matters after 60. I've heard people say, I'm already 70, the sun damage has already happened. Why bother with sunscreen now? Because sun damage doesn't stop accumulating when you reach a certain birthday. Every additional sunburn and every additional year of significant UV exposure can continue damaging your skin. Sun protection can help reduce additional damage and may lower your risk of developing more precancerous skin changes, those actinic keratosis I talked about. Use broad spectrum sunscreen on exposed skin when you're outside. And remember, the places people frequently forget, guys: ears, neck, back of the hands, and scalp if your hair is thinning. Hats, sunglasses, shade, and sun protective clothing can be very helpful also. Sunscreen after 60 isn't just about preventing wrinkles. It's about protecting your health. Number 8, your feet and toenails can reveal problems too. Take a look at your toenails. Have they become yellow, thick, brittle, crumbly? You may have onychomycosis, which is simply the medical term for a fungal nail infection. Fungal infections of the nails and feet become way more common as we age. You might also notice peeling, cracking, or itching in between the toes from athlete's foot. And it's tempting to think it's just an ugly toenail, who cares? But this isn't always just cosmetic. Cracked skin can create an opening for bacteria and potentially lead to infection. That's particularly important for people with diabetes, poor circulation, or problems with wound healing. If your toenails or the skin between your toes have significantly changed, mention it to your healthcare provider. Number 9, your medications may be changing your skin. This is another one people frequently miss. Sometimes the problem isn't actually your skin, it's something you're taking. As we get older, we're way more likely to take multiple medications, especially prescription ones, over-the-counter medications, and supplements. Some medications can make you more sensitive to sunlight. Others can contribute to rashes, dryness, bruising, or changes in how easily you bleed. Blood thinners, for example, can make bruises much more noticeable. Certain medications may also increase your sensitivity to sunlight, meaning you may burn more easily than you did before. So here's something useful to think about. If you recently started a new medication and notice a new skin problem, think about the timing. Tell your doctor when the skin change started and when you began the medication. But don't stop a medication on your own. Your doctor can help determine whether the medication is actually responsible and what to do next. Number 10, a skin exam can find problems you never knew even were there. Think about it. When was the last time you carefully examined the middle of your back? What about the top of your scalp, behind your ears, the backs of your legs? Research examining older adults has found that skin conditions are incredibly common, and many people have multiple skin problems at the same time. But a lot of those conditions can go unnoticed because they're in places we rarely see. A suspicious lesion could be hiding on your scalp, a precancerous spot might be behind your ear, a changing mole might be sitting in the middle of your back. That's why a thorough skin examination can be especially valuable if you have significant sun damage, lots of unusual moles, personal history of skin cancer, or other risk factors. A dermatologist can examine areas you probably haven't looked at closely in years. And when it comes to skin cancer, finding a suspicious lesion early can make an enormous difference. So if you're over 60, here is what I want you to remember. Getting older changes your skin. That's normal. Dryness, thinning skin, bruising, wrinkles, and other changes become much more common. But don't make the mistake of assuming every new skin problem is simply part of getting older. Remember the warning signs we talked about. These are a rough patch that doesn't disappear, a sore that won't heal, a spot that repeatedly bleeds or crusts, a mole that is changing, a new growth, or persistent unexplained itching. Keep your skin moisturized, keep protecting yourself from the sun, and every so often actually look at your own skin, including the places you would normally ignore. You've lived in this skin for more than 60 years, so you know what's normal for you. And sometimes noticing one tiny change early can prevent a much bigger problem later. If you're over 60, let me know in the comments what change in your skin surprised you the most as you got older. And if you know someone in their 60s, 70s, 80s who could benefit from this information, send them this video. And guys, please remember to hit like and subscribe. for more practical health information to help you stay healthier as you get older. And remember, information online cannot replace personalized medical care. If you're concerned about a new or changing skin problem, talk to your personal dermatologist. See you in the next video.